Good afternoon. I'm Justin. I'm the nurse manager at Weinberg 4A, soon to be 4AB as of the 12th of October. So that will be happening on Thursday. So bringing you your HiFive Friday, I'd like to start out by saying the BREM Foundation, as a department, we are setting boxes around on different units. We are collecting new and or used bras to make a large donation to the BREM Foundation. Anybody who donates, please talk to your nurse manager and they will give you a pair of shoelaces, the breast cancer awareness shoelaces. So hopefully we will be giving a lot of those out. The boxes will be set out until the end of October, I believe. So thank you for your support with that. We would like to give a big shout out to the Viragh team. They've been raving in purple today for the Ravens. So the Ravens will be playing on Sunday at 1 o'clock. And basically, thank you for showing support to the local Baltimore team. And I will take a pause for some pictures of that. All righty. So from there, I will bring up CLABSI. So as a department, we have had quite a few CLABSIs this year. I believe we are up to 20, and we do not want to go any higher than 20. So obviously we are talking about this because it's very important. Our patients obviously do not want to stay in the hospital any longer than they have to, and we don't want them to get infections and become septic and things of that nature, obviously. So we are, as a department, working on reducing the risk of CLABSIs. On the inpatient world, we just recently rolled out this week CPR, which is our new acronym to describe what to do at shift change. So day shift and night shift, we are going in, we're doing our report, we're doing bedside handoff and CPR, which is central line. We'll be looking at the patient's central line, making sure that dressing is intact. The date is on there. It's in the correct place. The date is within date. Obviously, we have to change dressings at the most or at the longest every 7 days or when soiled or coming off. So we're going to look at that at shift change. The P is for pole. So IV pole. We will be looking at that to make sure that the tubing is dated, the bags are dated, and within date. If not, the off-going nurse will be responsible for changing those things, the dressing or the tubing. And then for R, we're going to be looking at our pumps, and we're going to make sure that anything running is going at the correct rate at that handoff. And last, we will add the second R, so CPRR, and that is going to be risks. So obviously, we're going to discuss patient fall risk at shift change, moderate or high, whatever it may be, making sure that the appropriate interventions are in place. So that's it for CLABSI and falls and our new CPR rollout. So thank you all for being champions on that and making sure that we are doing that at shift change. In addition to that, charge nurses, nurse managers, we are going to be rounding more frequently than we have been to make sure that these central lines are well taken care of. Patients are getting their CHG wipes, linen is being changed, and all those good things. From there, I will go to flu vaccine. So it's flu time to get your vaccine. Please do not wait until the last minute. Clearly no one on 5C or D has been waiting till the last minute because Sally has given over 100 flu shots. So Sally is your gal if you want to go get a flu shot. She clearly knows what she's doing. If you are requesting a religious exemption for that, the deadline is Halloween. So obviously the 31st, the end of the month here. So other than that, the deadline for the vaccine is November 17th. So make sure you're not waiting till the 16th to get it. Get that as soon as possible. Lastly, I will say, do you know a nurse that goes above and beyond? If you do, I'm sure that you do. We all know somebody that goes above and beyond. Please nominate them for the Baltimore Magazine's Top Nurse 2024. So please support each other as we do with giving applauses and real-time feedback and positive feedback to everybody. Take a little extra time and give that feedback and send in a nomination to the Baltimore Magazine Top Nurses issue. Other than that, it says use the link in the email to nominate somebody. So there you go. That's it. Go Orioles, go Terps, go Ravens. It's a big Baltimore weekend here. Everyone have a good one. Happy Friday.